Give me something to hold on, something I can feel. Let me crash to the floor, at least I'll know that it's real. Rock bottom is scary if you've never been before. 'Cause it's easy to lose yourself on the way down. Let me get to the part where I hit solid ground. If I know where I am, then I can start to heal. Give me something I can feel.
A visual description of what Kruti and Richa are wearing is Kruti is wearing a pink cardigan over a light blue top. Richa is wearing a gray top. Kruti and Richa are sitting on a beige couch with blue pillows to their sides.
Welcome to Breaking Barriers with KRK. I called it. Welcome back, everyone.
Yes, thanks for tuning in. And we are going to be interviewing Kruti now on the healthcare system and any gaps that it has. First question we're going to ask is about when you go see the doctor, whether for yourself or for your kids. How has that experience been?
Great question. I want to mention that I'm a healthcare professional myself, right? Like I'm a pharmacist, and whenever I'm talking about the healthcare system, that includes doctors, nurses, I want to make sure that I'm conveying that we're all on one team, but we can together do better. So I don't want to smash the existing system. I know that people have good intentions, that they're providers. I want to make sure that I'm giving a lot of respect and credit and value the healthcare system that we have in place to ensure that people have the healthcare access that we need, medical doctors and the healthcare providers that we need for our health and well-being. But I do want to mention that sometimes disabled individuals are the ones who are usually kind of left behind or are missed out. From my case, I felt like the last few years I've had to go to the doctor's office a lot. When I was pregnant, I was going to OBGYN's office a lot. And then after having children, both of them, they were, constantly getting sick and going to pediatrician's office. My experience was kind of skewed a little bit more, especially because we were in the pandemic. Pandemic masking is important, but though that became a barrier for me. So what ended up happening is that as soon as I go to the doctor's office, they're asking me a bunch of questions through behind the plexiglass. Have you had any COVID-related symptoms? Have you traveled in the past 3 months? But each time they're asking me those questions, I'm not at ease. Like I'm worried, would I miss something? And I don't know the receptionist that well. So when they're asking me questions, if I goof up, I already know that somebody is judging me, and that's not a comfortable interaction to have.
The hearing aids don't help with it even?
Hearing aids or even cochlear implant, they get you very close, but they're not so 100%. So lip reading is something we still rely on with our hearing aids present. Now, the other thing is that studies show that plexiglass or face shield, they actually muffle the sound, and hearing aid thinks that it's a background noise, so it kind of filters it out. And so then as it is, we're hearing softer version of what other people are hearing. So it makes it harder. Because at the end of the day, even a very expensive $1,800 hearing aid is a machine. So it's hard for the hearing aid to figure out whether it's human noise or background noise.
Now, you've talked to the receptionist through that plexiglass where there's already that uncomfortable interaction. Now you're ready to sit in the waiting room.
Right.
How is that?
Interestingly, once I'm done with the check-in process, I'm still not at ease because I know I'm anticipating a nurse who's going to come and stand at the doorway and say my name. But because of the mask, I'm pretty sure I'm either going to miss it or get up when somebody else's name is being called. And I'm worried about those situations because, again, I'm worried that I'm being judged, every step of the way because I don't know these people really well. It's nerve-wracking. I just wish that there were systems where I could electronically check in, all these questions that the receptionist just asked me. I wish there was a way I could just put it on my phone and just answer yes, no. And when my turn is up, other than the audio cue, it would be nice to have a visual cue, like a number system when you go to a DMV's office, or even a text message on your phone that your turn is up. You can
Or even like
walk
at a
to-
restaurant when you have that buzzer.
Exactly. Go to room number 24 or something like that. So I think all of those things require people to think outside the box. But that's why healthcare providers are smart, and the system is all about providing equitable care. And we would make sure that if they could think about those things, then it would be really helpful to make an inclusive
Yeah.
environment.
Being in the doctor's office often can be in itself nerve-wracking because who knows what might happen in the doctor's
Right.
office. So you also have that base layer of being nervous. So now they call your name and you're having that like built up anxiousness already. Now you're in the doctor's office. How is that?
At this point, I've talked to the receptionist. So I'm like, what did you say? Sorry, can you repeat that? I'm hard of hearing. I passed that zone. Then the nurse called me, and if there's any group of them, I'm like, I'm hard of hearing. I didn't hear what you said. And then the third person comes, and then I'm repeating myself again. I'm hard of hearing. It's almost like, why do I need to repeat myself? Like it'd be nice if the system was integrated in a way that people knew some of the things. If it's a doctor, having clear masks, for example, during the pandemic, just put them on before you enter the room. If the doctor were to do that, it would make me feel so valued, and it would make me feel like the doctor actually took the time to review my chart before coming to see me. Usually in a patient's room, it's quiet, it's fine. But I've noticed like when the mask is on and I'm not able to see the doctor's face and I'm turned away and the doctor's like, raise your hand. And I'm like doing something completely different, like raise my hand, making light of things. But you have to imagine, like you don't want to be embarrassed in front of the doctor because I'm not dumb, but I feel like the situation is as such that I'm almost set up for failure. I'm set up for this embarrassment that I'm not really looking forward to. So when you ask me, it's already nerve wracking. When you add a layer of that disability, I'm not at ease. And I think it would be nice if, even before the check-in process started, if they had asked me, what are some of the things that you would want us to make sure we do while we care for you? I could have just said, have clear mask available or something like that ahead of time so they can prep. And that way I also feel at ease.
Seen.
Yeah.
Now we've talked about the actual visit to the doctor, and there's also the insurance part. How much does insurance cover your hearing aid? A little bit, right?
No, unfortunately, hearing aids are not covered by our insurance. I have, health, private insurance, but I still don't have hearing aid coverage. I think Medicare covers a portion of it. I grew up in Canada, so when I was in Canada, when I navigated hearing aid process, everything was completely free, or at least almost free, and then the rest of it you'd have to compensate by your own out-of-pocket expenses, but still it was manageable. Here, hearing aid costs $1,800 per side, so one side is $1,800. So having both is like $3,600.
And how often do you have to replace your hearing aids?
About 5 to 7 years. But the batteries are like a monthly cost that you're investing in. Yeah, it's expensive. And the thing about hearing aids is that if you don't switch them out, the quality goes down. But also new technology keeps coming out. So it's like using
new phone.
phone. Yep, exactly. Perfect analogy to think of. And so yeah, they're not covered. So insurance is a huge there's a huge loophole there.
Yeah, it needs to cover and make everything equitable. Is there anything else you'd like to add for our listeners?
Don't be scared to give feedback. Like if you had a negative experience or an experience where you would want it that you wanted to be treated better, it's okay to send a nice email or something like that, or a feedback survey if they have, to just say, hey, it would be nice to include some of these things. Even if you do it 50 times, even if one of the practices can make a change, they can then model that change for other practices. So I think just don't be scared to notify somebody that you had that experience, is what I can say.
Always giving that feedback, whether if it's good or bad. Yeah. Well, thanks, Kruti. I just wish our insurance was better. And I do hope the healthcare system can continue to get better. And I think the advocacy work you're doing is amazing. And hopefully those kind of communities will keep on pushing the standard and making it better.
We just need to keep pushing and challenge some of the practices that are in place.
Breaking those barriers.
Yeah.
Always.
That's it. That's it. So, folks, next time we'll please join us for a conversation with Richa, where we're going to ask her about the barriers she faced in the healthcare journey navigating depression.
Yeah.
Yeah.
And please, as always, continue these conversations. I just don't want us to ever forget that. And
Yeah.
thanks for joining us.
Take
And
care.
bye.
Bye.
Thank you to Mandy Harvey for giving us permission to use her song Something I Can Feel in our intro.